Anytime a cat shows a urinary symptom, any urinary symptom, the first thought most people have is it must be a urinary tract infection. And while this is a possibility, urinary tract infections are rare in cats. It is estimated that only 1 to 2% of cats will develop a urinary tract infection in their lifetime. So let's chat about urinary tract infections in cats, what it actually is, how we diagnose it, treatments that work, treatments that don't work, and why the term urinary tract infection is often used incorrectly. Hi everyone, I am Dr. Oz. If I can get a little technical for a moment, a urinary tract infection is defined as the adherence, multiplication, and persistence of an infectious agent, most commonly bacteria, but it could be a few other things, within the urinary system that causes an inflammatory response and symptoms. Here's the tricky part. There is not a single symptom that only occurs with a urinary tract infection. Straining to urinate, frequent trips to the litter box, peeing outside the litter box, licking back there, crying out when urinating, and even blood in the urine. These can all be caused by other urinary issues and are not specific to a urinary tract infection. Younger cats, older cats, and female cats are more likely to develop a urinary tract infection, but any cat can get one. The gold standard test to diagnose a urinary tract infection is a urine culture and sensitivity. Urine is collected in a sterile way, placed on a petri dish, and monitored to see if bacteria grows. If it does, the lab identifies the bacteria type and tests which antibiotics work best against it. Urine cultures can take a few days to get results. However, some reference laboratories are using lasers to detect bacteria in urine samples, which provides more accurate results faster. A urinalysis may suggest a urinary tract infection. However, just seeing bacteria under a microscope does not always mean there's an infection. And not seeing any bacteria, well, you still could have an infection, especially in dilute urine. That's why a urine culture is best. Let's chat about some statements I commonly hear and the implications they may have. We couldn't get a urine sample, so we just started antibiotics. Empirical treatment, or treating based on an educated guess with an antibiotic, is rarely the right course of action. Because urinary tract infections are rare in cats, this should not be the automatic approach. When this approach is taken, cats generally get better shortly after starting the antibiotic, only to show urinary symptoms later on down the road, typically when the antibiotic is stopped. If I can't get a urine sample during the exam, I will either have that cat come back later to get a sample, or I will keep the cat in the hospital for a few hours after administering fluids under the skin to get a urine sample later in the day. Another reason just starting antibiotics is not a good approach: antibacterial resistance. Things that are not fun include having to reach for an older antibiotic, one that we as a profession don't really use anymore due to its side effects, because the bacteria we grew from a cat's urine is resistant to all current commonly used antibiotics. Even though urinary tract infections are a common reason to prescribe an antibiotic, when urine tests are not performed, antibiotics are either overprescribed or incorrectly prescribed in cats with a different urinary issue, like crystal stones or FIC. And this can lead into the second statement I commonly hear: my cat gets urinary tract infections often. When I hear this, I think of two things. My first thought is, are these urinary tract infections being diagnosed correctly? This happens frequently when we are just treating and not diagnosing. And many of these cats have a different urinary issue going on, something an antibiotic cannot address. If we are diagnosing urinary tract infections properly, with a urine culture and sensitivity, and choosing an effective antibiotic, one that is listed on the sensitivity report, that should be it. For the most part, urinary tract infections are easy to treat and they should not keep coming back. My second thought is that if a cat is genuinely having multiple urinary tract infections, there's an underlying medical issue going on. Think kidney disease, diabetes, thyroid disease, digestive tract disease, especially if there's soft stool or diarrhea, or it can happen in cats that are on immunosuppressing medications like a steroid. My vet saw bacteria and prescribed an antibiotic. Seeing is believing, right? Not always, and definitely not with a urine sample. Just seeing bacteria in your cat's urine does not mean they have a urinary tract infection. When I hear this, I immediately have two questions. What bacteria is it, and how did we get the urine sample? Going back to that nerdy definition of a urinary tract infection at the beginning of the video, just seeing bacteria in your cat's urine does not mean they are adhering to the bladder wall, making more bacteria babies, and persisting to cause inflammation and urinary symptoms. Some bacteria like Enterococcus may be normal in some cats, and in these cases, we only treat when a cat shows urinary symptoms. If we continue to grow Enterococcus and there are no urinary symptoms, we just monitor. This is yet another reason to culture your cat's urine, because if we grow a bacteria we don't necessarily worry about, we do not have to treat with an antibiotic. And not having to medicate your cat? Priceless. How did we get our urine sample? If urine was collected from the bottom of a carrier, from a tabletop, or at home using the non-absorbent plastic pellets from a litter box, we will see bacteria because bacteria is everywhere. So if the urine sample was not collected sterilely, expect to see bacteria on a urine test. On the contrary, not seeing bacteria does not rule out a urinary tract infection, especially in dilute urine, which can be common in cats with kidney disease and diabetes. I can't count the number of times I've grown bacteria from dilute urine without seeing bacteria, red blood cells, or white blood cells to diagnose a urinary tract infection. Here's a summary on the ways we can detect bacteria from your cat's urine. Growing and identifying the specific bacteria with a culture is best. Seeing bacteria with a microscope from a urine sediment, often part of a urinalysis, is okay, but it has the limitations I just mentioned. And using a dipstick to determine if bacteria is present with a color change is very inaccurate. Dipsticks should not be used to detect bacteria in your cat's urine, period. Here are my recommendations. The best way to collect a sterile urine sample is with a cystocentesis, inserting a needle into the bladder. This is necessary to prevent contamination of the urine sample, which can happen from anything: cups, cat carriers, tabletops, and litter boxes. And this helps ensure our test results are accurate. I know this sounds scary and painful. A trained professional can easily feel a cat's bladder to obtain a urine sample with a needle while a cat lies on their side. For small bladders or bigger cats, oftentimes I will use a portable ultrasound to see a bladder, which helps guide my needle to obtain a urine sample. Still not convinced? Remember, to get a blood sample from your cat, we are sticking a small needle in a tiny blood vessel, pulling back slowly while your cat remains still during the entire process. In my opinion, in most cases, it is much easier to get a urine sample with a needle from a big ball of fluid, your cat's bladder, than it is a blood sample using a needle in a tiny blood vessel. Now that we have our urine sample, let's go over the recommended test if your cat is having urinary symptoms. At minimum, you should have a urinalysis done, ideally with a sterile urine sample. Better, run a urine culture and sensitivity at the same time as a urinalysis. Best, if you can swing it, perform some imaging, either in the form of an x-ray or an ultrasound, in addition to a urinalysis and a urine culture and sensitivity. If you can't do everything at once, no worries. We start with a urinalysis and add in additional tests at a later date if indicated. If we grow bacteria, I always recommend repeating a urine culture and sensitivity test at least 7 days after the last dose of the antibiotic to make sure the urinary tract infection is resolved. If you do a urine culture while a cat is taking an antibiotic or too soon after stopping an antibiotic, you may get a false negative result. The only time I culture urine while a cat is taking an antibiotic is if we are dealing with a resistant bug and we're trying to gauge whether or not the current antibiotic is working. Urinary tract infection treatment. True urinary tract infections are treated with an effective antibiotic. Everything else is purely anecdotal without scientific evidence to support it. There are no home remedies. There are no preventatives. Changing your cat's litter will not prevent a urinary tract infection. Diets and probiotics will not prevent a urinary tract infection. Buying urinary products and supplements online will not prevent a urinary tract infection. Cranberries? No. Apple cider vinegar? No. Glucosamine and chondroitin? No. If you've tried these products and claim that they work, I'd question whether or not your cat really has a urinary tract infection. If your vet has prescribed an antibiotic, continue treatment as directed and finish the full course. Do not stop early, even if your cat is looking and feeling better after a few days. It's tempting, I get it. Cats are a pain to medicate. But if you stop too soon, that urinary tract infection can come right back, potentially with resistance to the antibiotic you are currently using. So if your cat is showing urinary symptoms, don't assume it's a urinary tract infection. Start with the proper urine tests. Know how your cat's urine was collected. Know the limitations of the test and avoid unnecessary antibiotics. One important note, young male cats with urinary symptoms are especially concerning, since crystals and urinary blockages are more common than urinary tract infections, and these can be emergencies. If you're interested, check out the links in the description to some scientific papers and the links to my other urinary videos. If you enjoyed this video, make sure you like, subscribe, and comment. Thanks so much for watching, and I'll see you on my next video.